Hi, this is Dr. Kaustubh Mahajan, consultant neurologist at Fortis Raheja Hospital, Mahim. So today we'll speak on chronic headaches, whether it can be a serious condition. So the answer is 50-50, where usually what we define as chronic headaches are any headaches which have been there since more than 6 months. They can be on and off, they can be daily. Most of these chronic headaches turn out to be benign. By benign we mean they will be non-worrisome, or what we call as primary headaches. Primary headaches are basically when we do any imaging, there is no secondary cause. The imaging and blood test will come normal. But saying this, chronic headaches can turn out to be a serious condition if there are these red flags. Now, these red flags are very important to identify by the patient or by the physician, and if missed, we can miss a treatable condition and a life-saving procedure can be avoided if missed. So, what are these red flags? The first is change in pattern of these headaches. Headache which has been there especially only in the afternoon hours and now is happening throughout the day. So this pattern change, if we are noticing, that is a red flag. Second, if the headaches are now associated with new symptoms, like earlier it was never associated with vomiting, now there's vomiting, or earlier there was always nausea and when severe there was vomiting, but now there's only vomiting without any nausea. That these fine things are very important to be understood. Third, there's new symptoms like patient has now started to get vertigo, patient has some tingling numbness in one hand, patient has any new neurological symptom like forgetting things or speech issues. This is definitely a red flag where you have to image the patient in the form of an MRI to find out the secondary cause. The other red flags for these patients are especially when the doctor examines the patient and there is a new sign in the way the cranial nerve deficits, there's some double vision, there's some deviation of mouth, then that's a red flag. Or there are any new constitutional symptoms associated with it, like patient is now having fever, patient is now having loose motions or vomiting, patient has lost weight. So these constitutional symptoms should ring a bell that this is time to image the patient for a secondary cause. So there have been examples recently which we have seen many a times, patients saying chronic headaches are missed out to be chronic migraines or tension headaches, and we miss on something life-saving which could have been done. Recently we had a patient where patient had chronic headaches, was being treated as migraine, and now she had started to get forgetfulness, and the forgetfulness was something definitely new, but was put forward to stress, lack of sleep. And when you examine these patients properly, you come to know that this is not something functional, it is something worrisome. And that's when we saw that the patient had a tumor. So the problem is migraines and tension headaches are so common that they are almost there in most of the patients and most of the normal people, in fact. And then when they start getting a new headache, you have to identify, and that can turn out to be a serious condition. We don't want to miss something like raised intracranial pressure. We don't want to miss something like a tumor inside the brain or some infections. Thank you.